The temporomandibular joint is right here. That's the actual. Good girl. It's right here, okay? It's right below that bone, right here. That's the actual hinge, all right? If you just gently rest your fingers, you can do both sides at once or one side at a time. You just gently do egg yolk here, and I'm going to watch her eyes and her mouth and watch her responses. And sometimes, this is another boring one, but I'm going to just gently, the blink, stay with me, big girl. I'm going to just gently rest on there. And I have one finger right. You'll feel a little bump sometimes. Just gently rest on it like egg yolk. And this is another one where you got to take a minute. You can see her breathing change. I'm going to stay on it. You got to stay with us, Rose. There we go. We're getting a little release there. So that softens that joint up a little bit, the ligaments and the tendons on the joint. And you'll do both sides. And you can leave it at that. A lot of times that's good. I mean, that's very good just to do that. But I like to move the jaw around a little bit and just get the joint moving a little bit. And I do that by, with one hand on her nose, softly. And then the other hand on her lower jaw, in here where there's no teeth. And I'll wait for her to stop. The trick is you don't pull on their nose. You got to just kind of... And I'm going to ask her to come this way a little bit. And I'm going to just push away from me with the lower hand. And towards me with the upper hand, a little at a time. Just a little bit. It's a long lever there. If you force it, you know, it's a small joint. And a long lever, you could cause some damage. I just want to get her mouth moving side to side a little bit. And check. I got a little movement there. I'm looking up in here, and I'll see, and you can actually see when they're, I'll back her up so she doesn't hit her head or she goes up. Back up. Come here. But you soften it up first with that. There's a little more movement right here now. And I'm going away like that, okay? And you bring the head over to the side that you're working on. It actually helps flex the atlas a little bit. Now that feels much looser. At first she resisted just because she doesn't want me moving her jaw around, but... Huh? So that's how you release the TMJ. And you do lots of horses and you start to feel, oh, this one's really, you know, tight, and this one feels good, you know. The key is you don't force it. You're just trying to get a little bit more movement in it than they normally do, okay? Is there any questions on that? Does anybody want to try? Okay.
It was really cool because I could see this on the other side. When
Moving, yeah.
It got bigger as
okay.
that she did it.
And that right in here is, can you feel that joint, the TMJ itself?
Yes. Right,
There's an L. There's right here and here, and it's right in the inside of the L. Okay.
Like there's like a little knot there.
Yeah, there's a little knot you'll feel there, and if sometimes you just hold that knot, when they lick and chew, the knot will soften and get smaller. Okay. Yeah. Okay. Oops. So we're going to just ask her to go to the side, and then let her come back again, and then ask her to go over. See that little lateral?
Yeah.
Just there. That was as far as we want to go. Okay. Did you feel it go sideways?
Yes.
You sure?
Yes.
You're not just saying no. I mean yes.
Yeah, no.
Okay.
Yes, no.
Okay. Does everybody want to try it, or do you have it, or you want to go practice that? Okay, some simple techniques to release tension in the TMJ, which is the temporomandibular joint. The TMJ is the joint between the mandible and the skull, and it's a little hinge joint. It's right in here. I mean, there's a lot more to it all down here, but this is basically the point where the joint is. You can feel a bump here. If you want to come in close and take a look here, there's a lump here, and then there's a little deficit here, a little valley here, and then there's another little bump here. Between those two is the actual joint. So with the Masterson method, we use whatever level touch it takes to bypass the horse's survival response, which is a bracing response. And with the TMJ here, the best level of pressure to start with here is what I call air gap, which is barely touching, or egg yolk, which is probably just that much pressure. I'm demonstrating down here on his cheek. That's we want to use the lightest pressure we can, and I'm just going to rest my fingertips, flats of my fingertips right here on the joint, and I can use one fingertip or two fingertips to cover that area, and I'm just going to rest. Let me do my left hand. Rest my fingertips here. Now if I do it softly, I'm waiting for the signs of release and relaxation. Response would be blink. See his eyes soften and start to blink. And I'm using air gap pressure here, which I'm barely touching. Now this is, you have to give the horse a minute, his nervous system, to start to respond to this. But you can see as, there we go, his eyes soften, now he starts to lick and chew. So that happened pretty quickly with him. And he's starting to release tension in this joint already. And this is just by me barely touching the skin. And you want to resist the temptation. If you have to have patience. You have to resist this temptation to push harder. Because when you push harder, the horse just blocks it out. If you want to do anything, you want to do even lighter. There we go. See, even lighter. He softened. Now I'm really air gap, barely touching. You see how that works? I was going too hard, even though he had learned to kind of block out that really light, where I was. And by going even lighter, his nervous system had to yield a little bit. Now I'm not touching. Just kidding, I'm bringing his awareness there. I'm an inch off his skin, half an inch. And his nervous system, it brings awareness to that area and it brings circulation there. Whereas just touching, he had learned to guard against that. So I'm going to move right on to the next step of after you release tension in the TMJ itself here, with this light touch, you do both sides. And I'll often do both sides at the same time. But you'll give that a minute. And look for the first releases and the softening. And then I'm going to just ask him to gently move his jaw side to side. And I'm not going to use a lot of force here. I'm just going to stick my thumb in here where there's no teeth. I'm just going to gently, as he opens his mouth, just kind of ask him to move it to the side. Now he's very tense. There we go. He moved his jaw to the side a little bit. That's all we need. And I'm going to turn him this way. Step over, bud. Step over. Go on. And I'm going to do the same on this side. I'm going to just gently stick my thumb in here with my hand on his nose, just as he opens his mouth. Now when he throws his head up, I go with him. I don't pull down. And I'm going to ask him as he opens his mouth. See him move his jaw to the side a little bit? Right there. That's all we need. Did you see that? Lateral movement of the jaw. That's all we need to do. After we soften up the TMJ with our fingers, doing the very light touch, then we just ask him to move his jaw side to side. Right, buddy? Are you starting to relax into this a little? There we go, a little. He released a little air. So he's not a big talker, but he is a head-shy horse with a lot of tension in his poll and in his TMJ. And these techniques, these basic, very light techniques, staying under the bracing response, is going to allow him to move, to release tension in those areas, in his TMJ, and his poll and his neck, with just gentle movement in a relaxed state. That's the key to releasing the tension in the horse, is gentle movement, softening up, gentle movement in a relaxed state.